This week on Healthy Living, we are highlighting diphtheria and its impact on humanity. We will have advice on treating diphtheria from an expert. Plus, new robot-based technology helps address nursing shortages in health facilities. That's coming up on this edition of Healthy Living. Hello and welcome to Healthy Living. I'm Kamiti Kibayasi. The World Health Organization says diphtheria is a serious bacterial infection that usually affects the mucous membranes of the nose and throat. It spreads easily between people by direct contact or through air transmission via respiratory droplets from coughing or sneezing. In 2016, there were just over 7,000 cases of diphtheria worldwide reported by the WHO. In warmer climates, a person with diphtheria might develop skin sores that are very hard to heal. It is also possible for someone to be an asymptomatic carrier. Diphtheria is more likely to spread in areas and regions where there is lack of sanitation, poor hygiene, where people live together in very crowded spaces and do not have access to a vaccine. Now to West Africa, where a recent outbreak of diphtheria in Nigeria has killed dozens, and authorities say the potentially deadly bacterial infection is also showing up in neighboring Niger. Yusuf Abdullahi has more from Niamey in this report narrated by Vincent Makori.
This is Gure town, 165 kilometers east from the city of Damagaram in Niger Republic, where about 500 people have contracted diphtheria with 20 reported deaths. The situation is similar in the nearby town of Teska, where the disease has killed 15 people out of more than 40 who contracted it. It is the first time in 6 years diphtheria has shown up in the country.
Diphtheria is an infection of the throat, which also causes serious fever, headache, and the swelling of the neck.
The outbreak of the disease in Damagaram has put communities on edge given the number of people it had killed.
I am urging people to come for immunization against this infection because it is deadly.
The international medical organization Médecins Sans Frontières is working with health authorities in Niger on a specialized immunization campaign to fight the outbreak.
We are assisting the Nigerian authorities with medicines and workers to treat those who contracted the infection.
Since the start of the immunization campaign, the situation is coming under control. There has been no rejection.
About 400,000 people have been immunized during the first round of the immunization campaign against diphtheria in Damagaram. For Yusuf Abdullahi in Niamey, Niger, I'm Vincent Makori, VOA News.
Dr. Abdullahi Asi, Kano State epidemiologist, tells us more about the diphtheria outbreak in Nigeria.
Diphtheria is a vaccine-preventable bacterial infection caused by coronabacterian diphtheria, and it is transmitted via respiratory droplets during coughing, sneezing, or talking, or contact with secretions from an infected person. And usually an infected person presents with numerous symptoms depending on his or her background, immunity, and age. But generally they present with high-grade fever, sign of respiratory tract infections such as runny nose, cough, sneezing, difficulty in swallowing or throat pain, And then thereafter, if nothing is done, they go on to develop generalized neck swelling, with a deposit in their mouth, covering their epiglottis and other part of the respiratory tract membrane. And of course, in a more complicated cases, death could occur. Currently in the state, we have more than 380 suspected cases. Out of them, we are able to confirm diphtheria infection in about 37 of them. Of course, we are awaiting more results from the laboratory, and a good number of the results actually came out negative. This could be connected to the fact that some people would have started antibiotics before presenting to the hospital. And we have so far recorded more than 50 mortalities or deaths across among the both the confirmed cases and the suspected cases. And of course, we have so far treated and discharged close to 200 patients in the States. So far in Kano State, about up to 15 LGS are affected. And this LGS, of course, effort has been put in place to ensure we contain the spread of this disease. Already the Ministry of Health has started what we call routine immunization intensification campaigns, making sure that all eligible children, especially in this affected LGS, are fully vaccinated and immunized. Diphtheria is not a new disease, it's rather an old disease that is currently re-emerging. So part of the preventive measures is to ensure our children are fully immunized for age. Other preventive measures, of course, include the use of face mask, use of hand sanitizer, and then ensuring improvement in personal and hand hygiene, and equally making sure that contacts of infected persons are given prophylaxis, and they are equally advised to strictly follow protocol by making sure that they don't mishandle the patient.
Have you heard of calisthenics? No, it's not a disease, but it is a possible cure for young kids dealing with drug addiction. In Chimayo, in the Mozambican province of Manica, calisthenics keeps young people busy, physically healthy, and away from drugs.
Calisthenics is a set of physical exercises that uses the weight of one's own body to work on muscular strength and resistance. Dozens of young Mozambicans practice it as a refuge from drugs. Calisthenics became popular in Shimono, Manica's capital, in 2022 and is practiced professionally by those who were once addicted to drugs and with no focus in their life. Shimono's young people say they were doing street workouts, which attract more young people to the sport.
Yes, in fact, we have taken many young people off drugs, and that has been very beneficial. There are certain young people who are involved in marginality. People get involved in calisthenics in a natural way. People don't start out liking it, but as time goes by, people fall in love and drop other pursuits. Because they observe that this path I'm following is good. I'm battling addiction and I'm improving my physique.
A young person can come to practice without knowing anything about calisthenics because calisthenics exercises are divided into two branches, as my colleague said, being street workout and normal common exercises. Our exercises are based more now on street workouts, but a young person can come without any physical preparation, without knowing anything about calisthenics, and whenever he comes, we will give him the necessary knowledge and calisthenics training to get him used to the sport and motivate him more to do it.
Young people also use calisthenics to prepare themselves to enter the Defense and Security Forces Academy while staying away from addiction.
Because young people today have done a lot of nonsense, because they have nothing to do, I was also like that, unoccupied, and I thank the calisthenics group from Shimoyo, which pulled me from that world of drugs to here in calisthenics, and I feel very well, with a lot of disposition, with a lot of will to do anything.
The calisthenics group from Shimoyo dreams of being able to bring medals to Mozambique when they reach international competitions.
Because there are certain movements of calisthenics which are very fantastic. However, we don't show these movements because we can't. We don't have enough material. If we had some help, it would improve the sport.
Cholera cases in Port-au-Prince have been decreasing since November, according to physicians from Doctors Without Borders. Here's the report.
At Cité Soleil Clinic, located in the Haitian capital, patients suffering cholera symptoms are receiving treatment days after the Haiti police blocked streets and broke into the airport during a protest demanding justice for fellow police officers killed by armed gangs. Vincent Harris, a doctor at the clinic run by MSF, says the situation regarding the cholera outbreak in the capital is quite stable, but he reiterated that the epidemic is not over.
At the moment, with the situation regarding cholera, the situation is, let's say, quite stable on Port-au-Prince. Cases have been starting decreasing from November this year, and at the moment we continue to see patients, but at a lower rhythm than what it was on the month. The epidemic is not over. We continue to receive cases, and we are remaining operational regarding the cholera activities.
In January, Haiti registered more than 22,000 suspected cholera cases. Last week, the International Rescue Committee announced that it is preparing a response with local partners to combat cholera, provide health services, and support survivors of gender-based violence.
As the medical centers across the United States continue to struggle amid the nursing shortage, a hospital system just outside of Chicago, Illinois, is turning to futuristic technology to fill the need.
If you step inside Elmhurst Memorial Hospital, you just might see a 5-foot-tall robot with bright blue eyes roaming the hallway.
We've got 2 robots in the hospital, and between the 2, they are working 24/7 with only a short period of time to charge in between. So when you think about the numbers to staff humans to do that work, we would need at least 6 people to do that amount of work.
The robots, both named Moxie, are made by Texas-based Diligent Robotics and are used to ease the burden on hospital workers so they can spend more time attending to patients.
Supplies and medications and other things that we need from other areas of the hospital, she's able to move those around for us very easily. Put in the request on the iPad, and then in a few moments she'll come, and then she'll kind of announce herself with a little bit of a beep, and we can just scan our badge. She opens up one of her compartments, we place the device in, and then complete the transaction, and then she's on her way.
According to Elmhurst Memorial Hospital, the 2 robots made about 1,800 deliveries each month, traveled nearly 1,000 miles, and saved hospital staff well over 2 million steps, trekking back and forth across the facility. During that same 6-month period, Moxie's helping hand equated to over 3,100 hours of time returned back to the medical team. No matter how advanced the robot's artificial intelligence may be, workers say Moxie is not being used to engage with patients at Elmhurst Memorial Hospital.
We're not relying on Moxie to interact with patients. That's still our privilege and honor, so we get to spend more time with them.
We're really passionate about building robots that work as a team and really kind of fit seamlessly into a teamwork environment to take on some of the work that people in that environment don't really need to be doing.
Thomas strongly believes their product will be part of a healthcare future that regularly features robot assistants.
That's our show for today. For more health news, wellness tips, and medical breakthroughs, stay connected to Voice of America at voaafrica.com. Be sure to follow me on Twitter at MkamitiVOA. Until next time, stay well and strive to make every day a healthy day.